I think the challenge really is to try to find the appropriate patients for CAR T-cell therapy. We all recognize that CAR T-cell therapy can be fantastic, where we can eradicate the leukemia clone, and that may provide for long-term disease-free survival. However, there are also challenges involved in terms of the toxicity after administration of the CAR T-cells with cytokine release syndrome, as well as the neurotoxicities, which is a little bit mysterious and hard to understand. Patients can sometimes go through weeks, if not longer, of treatment in the hospital to take care of these problems. I've had patients that have been in the hospital for a few months, but then over time they can resolve and they become fully functional, and you just have to guide them through it. But it is a challenge in terms of trying to get them there. I've also noted that sometimes we reserve these therapies for patients who really have extensive disease, and we're really having the CAR T-cells do a heavy lifting to try and get rid of disease that's refractory to all of the other therapies that we have. I've had some patients that have actually been able to get CAR T-cell therapy with relatively minimal disease, and it was like getting a haircut. They got infused with their CAR T-cells, they was very effective, they got a good expansion, they left the hospital within a day, and they were actually then without detectable disease, and they're still without detectable disease. So the question is one of timing. If we can identify the appropriate patient that is likely not to succeed with some of the even newer targeted therapies that we have currently, we might want to get them treated earlier with effective CAR T-cell therapy. We're engaged with the Lysozyl study, which is being conducted as a CD19 CAR T-cell study, and it's going very well, either alone of CAR T-cells or in combination with the drug ibrutinib, which apparently seems to mitigate some of the toxicities associated with CAR T-cell therapy, including the cytokine release syndrome. And so this is making it perhaps easier, but I do think there are certain things that we can do to make it easier still, as I mentioned, in terms of the appropriate timing for therapy. But I do think it's a very exciting advance, because even though we certainly know chemotherapy has its limitations, but even targeted therapies can actually be limited when there's changes in the cell that is of sometimes the protein that's being targeted by the small molecule that mitigates the activity of these small molecules. And so we need something like CAR T-cell therapy, because these T-cells can cut through a tumor that's resistant to all of the therapies like a hot knife through butter. And it's really exciting to see. One of the most exciting things was walking down the corridor, and this guy who had failed everything, bulky disease, and he underwent CAR T-cell therapy. Had a rough go of it in the hospital, but then he successfully completed therapy, complete response without any detectable disease. And I heard my name, Dr. Kipps, Dr. Kipps. He was yelling down the hall, and he looked great. So this is amazing. It's life-saving, it can be transformative.